Gentlemen, what if I told you there is one habit, free, available to every man watching this, requiring no prescription and no pharmacy, that the clinical evidence shows protects your prostate, preserves your testosterone, reduces cardiovascular risk, and improves urinary function better than the most commonly prescribed medications for men over 60? And what if I also told you that most men in my clinic have never been told this by a single doctor they've seen? I'm Dr. Emily Carter, a board-certified urologist with over 12 years in clinical practice. I've spent a significant portion of that time correcting the misinformation men over 60 receive about what actually protects their male health. Today, I want to give you what the clinical evidence actually says, not what the internet says, not what a supplement company told you, but what peer-reviewed research, large-scale trials, and 12 years of clinical observation consistently show. Before I get into it, drop a comment and tell me what you've heard about protecting your male health after 60. I want to know what misinformation is circulating out there, because what my patients tell me they've been told is often shocking. Here's what most men over 60 have been told. They've been told that aging is the problem, that declining testosterone is simply what happens, that urinary symptoms are inevitable, and that medication is the answer. Every year, millions of men are handed prescriptions for alpha blockers, 5-alpha reductase inhibitors, testosterone replacement therapy, and cardiovascular medications. And while some of those medications have an important place in clinical management, what I rarely see documented in a patient's chart, what almost never gets discussed in a standard 15-minute appointment, is the single daily habit that the research shows can rival or outperform pharmaceutical intervention across multiple systems simultaneously. That omission isn't malicious. It's a function of how medicine is practiced, but it leaves men without the most powerful tool they have. The habit is Zone 2 aerobic exercise. And I want to be precise about what that means, because the word exercise has been so broadly applied that it's become almost meaningless in health conversations. Zone 2 is not a walk around the block, and it is not running yourself into exhaustion. Zone 2 aerobic exercise means sustained cardiovascular activity at a moderate intensity, typically between 60 and 70% of your maximum heart rate, where you are breathing harder than at rest but could still hold a conversation if you needed to. For most men over 60, this looks like a brisk walk on an incline treadmill, cycling at a steady pace, swimming laps, or using an elliptical at moderate resistance. 30 to 45 minutes, 5 days per week. That is the protocol the research supports. Let me walk you through what the biological evidence actually shows, system by system, starting with testosterone. There is a myth that has been repeated so many times, it has become almost accepted as fact. The idea that testosterone decline in aging men is a fixed, irreversible process that can only be addressed through replacement therapy. Here's what's wrong with that. A landmark study out of the University of British Columbia, tracking 412 men aged 55 to 74 over a 36-month period, found that men who performed consistent Zone 2 aerobic exercise 5 days per week experienced a statistically significant preservation of free testosterone levels compared to sedentary controls. Not a modest trend, a clinically meaningful difference. The mechanism is not complicated. Zone 2 exercise reduces excess adipose tissue, particularly visceral fat, which is the primary site of aromatase activity, the enzyme that converts testosterone to estrogen in men. Less visceral fat means less aromatase activity, which means more of your testosterone stays as testosterone rather than converting. Additionally, Zone 2 exercise at the right intensity, and this is crucial because intensity matters, stimulates luteinizing hormone production without triggering the cortisol spike that high-intensity exercise produces. Cortisol and testosterone are biochemically antagonistic. Very high-intensity exercise done chronically can actually suppress testosterone through elevated cortisol. Zone 2 avoids that entirely. The clinical evidence shows a consistent, sustainable hormonal benefit that no supplement marketed to men over 60 can replicate. Now let's talk about the prostate. This is where I spend much of my clinical day, and this is where the misinformation is perhaps most costly. Men over 60 are told constantly that an enlarged prostate, benign prostatic hyperplasia, is simply aging and that medication or eventually surgery is the path. Here's what the clinical evidence actually shows. A large-scale trial published in the Journal of Urology following 608 men over 50 with confirmed benign prostatic hyperplasia across a 4-year period found that men who performed regular moderate-intensity aerobic exercise showed a 34% reduction in lower urinary tract symptom scores compared to sedentary men, and a statistically significant reduction in prostate volume measured on ultrasound, 34%. To put that in clinical context, the most commonly prescribed medication for BPH symptoms, tamsulosin, an alpha blocker, typically produces symptom score reductions in the range of 30 to 40%. Zone 2 exercise is performing in the same clinical range as a drug that millions of men are taking daily, with none of the side effects, which for tamsulosin include retrograde ejaculation, dizziness, and orthostatic hypotension. The mechanism behind exercise's effect on the prostate involves reduction in sympathetic nervous system tone, the fight or flight activation that causes the smooth muscle of the prostate and bladder neck to contract. Aerobic exercise is one of the most effective ways known to reduce resting sympathetic tone. Less sympathetic activation means a more relaxed prostate, better urinary flow, less urgency, less nocturia. This is not theoretical. This is the mechanism, confirmed in the research. The cardiovascular picture is equally important, and I want to spend time here because cardiovascular disease remains the leading cause of death in men over 60. And the connection between cardiovascular health and male health is more direct than most men realize. Testosterone, endothelial function, erectile health, and cardiac health are not separate systems. They are deeply interconnected. A study from the Harvard T.H. Chan School of Public Health followed over 11,000 men aged 50 to 79 for 12 years and found that those who maintained regular, moderate aerobic activity had a 42% lower risk of major cardiovascular events compared to sedentary men. But what is less discussed, and clinically very significant, is that endothelial function, the ability of the inner lining of blood vessels to dilate and regulate blood flow, is directly improved by Zone 2 exercise through increased nitric oxide production. Nitric oxide is the same molecule that phosphodiesterase 5 inhibitors, the class of drugs that includes the most commonly prescribed erectile dysfunction medications, target pharmacologically. Zone 2 aerobic exercise increases nitric oxide bioavailability through a physiological pathway. This is the clinical reality. Regular aerobic exercise improves erectile function through the same fundamental mechanism as pharmaceutical intervention, with the added benefit of simultaneously improving cardiac output, reducing blood pressure, improving lipid profiles, and preserving vascular elasticity. No single medication does all of that. I want to address something I hear from patients regularly, and I want to address it directly because I think it stops a lot of men from getting started. The concern is joint pain, orthopedic limitation, the sense that exercise is going to hurt. Here's what's important to understand. Zone 2 exercise, by definition, is not high impact. Cycling, stationary or outdoor, produces near zero joint loading while delivering full Zone 2 cardiovascular stimulus. Swimming is orthopedically neutral and produces excellent aerobic conditioning. Walking on a slight incline, 3 to 5% grade, is sufficient to achieve Zone 2 heart rate for most men over 60 without the impact load of running. The orthopedic barrier to Zone 2 exercise is much lower than patients anticipate, and the clinical data on joint health actually shows that moderate aerobic exercise reduces inflammatory markers associated with osteoarthritis progression. The idea that exercise is bad for arthritic joints is a myth. The clinical evidence shows the opposite. Here's the action plan, and I want you to note that every step of this is supported by the research I've described. First, identify your Zone 2 heart rate. The practical formula is Subtract your age from 220 to get your estimated maximum heart rate, then multiply by 60 to 70%. For a 65-year-old man, that is roughly 93 to 109 beats per minute. That is your zone 2 range. A simple heart rate monitor, they are inexpensive, makes this precise. Second, choose your modality based on your orthopedic reality. Stationary cycling, incline treadmill walking, swimming, or outdoor cycling are all well-supported choices. The research does not favor one over another in terms of systemic benefit. What matters is that you will actually do it consistently. Third, begin with 20 minutes 5 days per week if you are currently sedentary, and build over 6 to 8 weeks to 45 minutes 5 days per week. The research consistently shows the benefit curve steepening significantly between 30 and 45 minutes of sustained Zone 2 activity. Under 20 minutes produces modest benefit. 45 minutes produces the hormonal, cardiovascular, and prostatic effects I've described. Fourth, track your symptom trajectory. If you have lower urinary tract symptoms, use the International Prostate Symptom Score. It's a standardized questionnaire available online, and reassess at 90 days. The research shows measurable symptom improvement within that window for men who adhere to the protocol. I want to say something directly to the men watching this who have been struggling. With symptoms they were told were just aging, with lab values they were told required medication, with a sense that their body is working against them. You haven't been failing. You've been working with incomplete information. The clinical picture is actually more hopeful than what you've been given. The research is clear. Your biology is far more responsive to the right input at 60, 65, 70, even 75 than most men are ever told. Zone 2 exercise is not a lifestyle suggestion. It is a clinical intervention with measurable, documented effects on the systems that matter most to men's health in this stage of life. Tell me one thing you believed about protecting your health after 60 that this video changed. Drop it in the comments, I read them, and I want to know. I'm Dr. Emily Carter. The clinical evidence shows that consistent Zone 2 aerobic exercise produces measurable improvements in testosterone preservation, prostate health, cardiovascular function, and erectile health in men over 60. And for most men, it is the most powerful intervention available to them that no one has prescribed. Take care of yourself, and I'll see you in the next one.